I am Anthonia Sowunmi, an associate professor, the first female associate professor in Radiation and Clinical Oncology in Nigeria. And I work with NSIA-LUTH Cancer Centre based in Lagos, Surulere, which is the first of its type in the sub-Saharan. It's a state-of-the-art cancer center. Thinking about what brought me into this specialty, or what made me, come into this specialty, interestingly, I prayed about it, right? And I also felt that there was no women there in the specialty. And considering the fact that breast cancer and cervical cancer are very common cancers in women that are deadly, and women, they would like to associate with a fellow female, I came into it so that I could make an impact and change things around, and also be able, to move cancer forward. So that was why I came into the specialty. And I'm glad I did, because I know I had made the impact. Okay, the biggest challenge in NLCC, I would say, of course, anything that is starting newly, because we used to be at LUTH before the merger, you'll realize that most of the time we'll have its teething problems, and people, especially the patients and relatives or populace of Nigeria, never really believed that we could have a very good cancer center like this. And so initially, patients were slow to come in, but as soon as they came in and they realized that we had the specialized hands, we had the right equipment, that we're not going to break down, the state of the art, comparable with what they have abroad, then they started coming in. And of course, I can tell you that we've had a large, turnover, and even success stories, because a lot of them have come in, they've been treated, and we have reduced the mass exodus of medical tourism in Nigeria, and we are glad about it. Considering the challenge I've had as a woman, honestly, you know that, of course, for women to be able to pursue their career, it's not easy. You have to be able to take care of your home and also take care of your career. But like I would always say, for with God, nothing is impossible. And if you have a spouse that is understanding, you will be able to go far. And those are the teaching, challenges we've had. And also, if your children are young, bringing them up, playing your role as a mother and your role as a wife, but you can manage all together, and it will be a success story with a lot of patience. So that's where we are today. My favorite hobby, I like unwinding. I like dancing, right? And I like, praying. And I reach out to people. I like evangelism. Those are the things that, I like. Those are my hobbies that I like. Honestly, achieving a healthy, work-life balance, you have to be determined to ensure that, you have that. Because most times when we come in, with the kind of equipment we have here, since it's a 3D computerized and state-of-the-art, you find out that you have a lot of work to do. You have to contour or mark out the disease area on the computer. So if care is not taken, you'll spend most of your time. But I would say this, that this cancer center have tried and gone a long way in making things, easy for us. We have a canteen. The atmosphere or our working environment is very conducive, and most of the time you don't feel the stress of working here. Yes, we have the patient flow, but because we also work as a team, and we have good communication, so things flow seamlessly. And the other thing is that once I finish work here, when I get home, I forget about work. I face the family. There are times I watch movies, listen to music. There are times I even dance, just to let out the stress and the tension of Lagos. As you all know, apart, on going home, depending on where you stay, you will have a lot of traffic. But, I've been able, with those ways, being able to maintain a healthy work life. In the medical field in the next 5 years, I will say this, from where we started, from when I first came in, right, as, a pioneer female radiation and clinical oncologist, right? They were just men. And I realized that communication was very important, and being able, you also need empathy, for the patients. And that, over time have progressed, even in terms of the equipment we had, right, till now. So it's been a journey, but a successful journey. A journey that the new things, the new researches, the new medical, innovations, equipment, and advancement have been brought into the treatment of cancer. And we've been seeing a lot of people surviving early. It's also been important because, right, we've been able to do a lot of education, campaigning, and people are now aware of what cancer is all about, and that it's not a death sentence, and it is not a stigma. So people are now coming out. We are getting them earlier, unlike in the advanced cases. And in the next 5-10 years, what I see now is that I expect that there will be a permanent cure to cancer. A lot of researches are going on, and it will just be like any chronic disease. Even right now, people, when they present early, they're living their normal lifestyle, right, and their normal lifespan, and nobody needs to know or that they have cancer. The only thing is that as a survivor, it's good to come out so that people will know the success story, and also to encourage other cancer patients. And so in the next 5-10 years, I believe that we'll get to that stage where there'll be a cure. The mortality or death rate of cancer will be reduced, and we'll have a lot of this type of center, being duplicated and in various political regions of Nigeria. And that will make things much easier for patients to access treatment. This I will say to everyone out there watching me. For the Nigerian or federal government, I will say thank you. They have really tried in terms of ensuring that we have a state-of-the-art cancer center. We need more. For the Nigerian populace, I will say, when you're being diagnosed with cancer, it's not a death sentence, right? We have the cure for it. We have the equipment. We have where you can access treatment. So come down to NSIA-LUTH. Friendly environment, friendly atmosphere, perfect treatment, excellent cure, excellent treatment outcome. You will achieve it. And for the women that are in the who are medical doctors, who probably want to have a career in oncology or even career anywhere else, what I'll say to them, because when I first started, we've had a lot more female coming into oncology treatment, into the specialty. So I will say that when you come in, be determined, but make sure there's a balance between the family life and your career. If you explain things, there's a good communication between you and your spouse, they will give you all the support that you need to be able to have a successful career. But also at the same time, always remember that the men are ahead, right? And that we have to be submissive, and you can always, with love, get them to be on your path. And then even when the children come, ensure that you play your role as a mother. It's possible. I think God had created us that way so that, at the end of the day, you look around you and you find out you have a whole, happy, comprehensive, family that is successful, and you are also successful in your career. And with that, and with God on your side, you're successful and you always make it. Thank you.